Hi, this is Mark Stuthers. Let's explore what is today's role for medical imaging services in healthcare. There's been a great change from the static film screen images that we used in the past to the interactive electronic medical images that we use today, where we can manipulate data and enhance information. Whether film screen or digital imaging, the medical imaging technologist needs to optimize the acquisition of the images for interpretation. There's a huge difference in skills and knowledge required in the film screen acquisition of images and the digital image workflow, including the use of artificial intelligence. Medical imaging technologists are constantly learning and upgrading their skills as technology evolves. The use of digital imaging combined with artificial intelligence has resulted in a tool that enhances the ability for patient throughput and diagnosis. Artificial intelligence is not a replacement for the human being. It is an excellent tool to help the human being do their job better. Medical imaging technologists are professionals who use various technologies to produce images of the human body for diagnostic, therapeutic, or research purposes. Medical imaging technologists are non-physicians that are highly qualified professionals who have completed extensive education and training in their field. They follow strict standards and regulations to ensure the safety and quality of their services. Most medical technologists are not only knowledgeable but altruistic. Altruism in healthcare, which is part of the Hippocratic Oath, is the unselfish concern for the welfare of others, while the reality of providing healthcare is the state of things that actually exist. So there is a dichotomy between altruism and reality. Patient care is the policies, practices, and structures that affect how healthcare is provided, delivered, and financed. This is reality. In healthcare, we try to optimize the reality to produce the best outcome for the patient. The practice of medical imaging enhances the professional competence and confidence of healthcare providers by relying on evidence-based practice and scientific knowledge. Medical imaging helps the radiologists and the requesting physicians make more accurate and informed decisions based on objective data. Medical imaging has developed rapidly to play a central role in medicine today by supporting diagnosis and treatment of disease. Medical imaging is crucial in a variety of medical settings and at all major levels of healthcare. Let's review some information that was provided by a recent study from the American Society of Radiologic Technologists. The ASRT did a sample survey. The survey sample represented staff technologists, therapists, chief technologists, and others, which would include supervisors, administrators, managers, and education program faculty, and administrators or directors of radiology. The survey posed the question about how artificial intelligence and technological evolution in medical imaging will affect the job of the technologist. An average of 24% of the respondents believed that artificial intelligence and machine learning features would reduce their role, and slightly more than 31% believed that the technology would reduce the role of the profession in general. Specifically, an average of 30.4% said automation from AI and machine learning would reduce their staffing levels, and 38.3% believed the technology would reduce staffing levels for the entire profession. The respondents were mixed in their familiarity with AI features on their equipment. Most are confident that those feature functions correctly provide trustworthy results. The respondents also indicated a lack of standardized process for resolving discrepancies between the machine-recommended procedures and the technologist's judgment. They were inclined to see AI as having a beneficial effect on considerations such as safety and quality, but worried about a deleterious effect on the more human aspects of the profession, such as patient interaction and creativity. With the rapid development and adaptation of AI in medical imaging, some people wonder if medical imaging technologists will become obsolete or redundant in the future. However, according to some experts and researchers, AI will not replace medical imaging technologists, but rather enhance their role and value in healthcare. Radiology is the field of medicine that uses imaging techniques to diagnose and treat disease. It may be used diagnostically in order to determine if a medical condition is present or not. Medical images can be used interventionally to guide the physicians in processes such as removing a blood clot in an artery, or it may be used as a plotting or therapy treatment program to treat cancer for radiation therapy patients. Radiology is more than simple interpretation of images. Today, there is a need for the radiologist to incorporate not only clinical imaging, but clinical laboratory findings into the interpretation of the images. This will help narrow down the differential diagnosis as well as guide the treating practitioner in decision-making regarding further investigations, therapy, or patient's prognosis. The biggest leap in medical imaging technology since CT scanning in 1972 appears to be the utilization of artificial intelligence in medical imaging. Artificial intelligence essentially refers to the ability of a computer to do tasks that are usually done by humans, using their natural intelligence such as in problem solving and decision making. So let's take a look at how a human solves a problem and then see how we try to mimic that process using a computer. Here we see a simple example. A human sees a cat. So the human has acquired the image. That image then goes into their brain and it comes up with the solution that it is a cat. Well, that's pretty simplistic, but let's take a little bit more of a look at the process. The human brain, or the neural network, stores information that it gathers over a period of time, and we call this memory. And we're able to utilize that memory to come up with solutions for problems. If we never knew about or experienced seeing a cat, would we know it is a cat? Now let's take a look at the computer neural network, which would be similar to our brain. The functionality of the computer network is similar. We have an input layer where we perceive something, then we have a hidden layer, which would be all of our storage of knowledge, and then we have an output layer, which would be the decision or the conclusion based upon what we've seen and our storage base of knowledge. That storage base of knowledge can also be like cultural differences. It depends on what information was put into the system and can it be biased or non-biased. This is why we need human intervention. Medical imaging technologists need to develop enhanced technical and analytical skills to compete in the rapidly evolving field of medical imaging. Advanced imaging modalities often involve more complex and sophisticated equipment and software, which require higher levels of technical and analytical skills to operate, troubleshoot, and to interpret. Advanced imaging modalities may also pose greater physical and mental challenges for technologists, such as longer work hours, heavier workload, and more stressful situations, which brings up the fact that you're going to have to make a cognitive choice when you become involved in an ethical dilemma, which only a human can do. You must not only understand the complete workflow process of how images are created, the basics of medical imaging, such as how different types of images are acquired, stored, and processed and displayed, you also need to be familiar with anatomy, physiology, and pathology of the human body and how they are represented in medical images. In acquiring and creating medical images, you also need to learn the advanced technique tools that are specific to medical imaging, such as convolutional neural networks, classification, detection, and registration, etc., because this will be an integral part of the final product. To be successful, your knowledge and skills must evolve and continually improve. Your skill set should include a very in-depth knowledge of medical imaging technology and the modality that you're using, and also a good knowledge of how artificial intelligence and AI can assist you in creating images. With the information that we've covered so far, there may be many reasons why you might be concerned about the future of your job, such as the changing economy, the impact of technology, and the competition from other workers, or the possibility of losing your skills or motivation. One of the best ways to reduce worry is to do something about it. Identify what you can control and what you can't control in your situation, and focus on the things that you can change or influence. You can do a number of things to improve your skill set and your knowledge base. You are required as a medical technologist, imaging technologist, to have continuing education. Continuing education can have many benefits for job security, especially in today's uncertain and competitive job market. The bottom line is you still need humans for healthcare, but you need healthcare workers with the correct skill sets and knowledge base to utilize the equipment of today and tomorrow.